Hi, so in this video we'll talk about type 2 diabetics and losing weight. So if you are type 2 diabetic, you're probably thinking I need to lose a bit of weight. Your doctor's probably given you a lot of pushing and pulling to try and get you to do so. Now, just as a background, type 2 diabetes is something that's ever increasing. There's lots of people out there that have got it and don't know that they've got it, and they only find out when they have routine tests. Now, as a type 2 diabetic, it is quite scary because we know that it progresses, and there are people still these days that are having real difficulty later in life. We have lots of people with all sorts of issues with their eyes, their feet, their senses. Also, some people might go on to injecting insulin every single day, and they are, unfortunately, some of them having amputations as a consequence of their type 2 diabetes. So it is really something we should be not ignoring. So what we find is that type 2 diabetes, one of the biggest risk factors is being overweight or especially obese. Now, there are other risk factors, and we can always discuss those if you want to contact us. Now, for type 2 diabetics, the difficulty is losing that weight just like anyone else, but obviously you've got to control your blood sugars. Now, what you find is if we can put you on the total food replacement program using Lipotrim, that's our sure plan, then this total food replacement program actually helps the type 2 diabetic very well. What we would need to do is you would need to come along and we need to fill the details out and do our usual consultation and explanation, and as long as it's something that you wanted to do, we would then need to get the GP on board. So you can always do this beforehand and have a chat with them before after seeing this film. Now, what happens to a type 2 diabetic is that as long as the GP is okay and as long as the patient is okay with the idea, what this means is you can stop your type 2 diabetic medication. Now, I must stress you can only do this if your GP says you can. Now, if you stop your type 2 diabetic medication and you start this program, then what you find is that by doing total food replacement, your blood sugars normalise within the first couple of days. You do not need that medication while you're dieting. And if you've seen the video already on our total food replacement and Lipotrim, if you haven't, then watch it, please. What it's going to do is means you're going to lose your weight nice and rapidly. You're going to lose, on average, 1 stone a month for women and 1.5 stone a month for men. So no matter what weight you've got to lose, that is the rate you'll lose it. So if you've got 8 stone to lose, it will take you on average 8 months. Now, while you're on this program and you're a type 2 diabetic, that means that effectively you're in remission. While you're on the diet, you're not taking your medication, your blood sugars are normal like they would be if you are a non-type 2 diabetic or you're a diet-controlled diabetic. And then what we'll do is we'll reintroduce your food in line with the refeeding that we do. And again, we'll cover that in another video, or you can always ask us and we'll give you plenty of literature on the subject of refeeding. So afterwards, you're on a normal diet. Yes, you would need to go and see your GP after that, and you would need to then have an assessment on your diabetes. Now, what you may well find is that because you've lost your weight and because you've done so well and you've managed to stick to this total food replacement program, what you will find is that your blood sugars should hopefully be down to normal levels and you can be diet controlled. Now, you still do have the potential to go back to being a type 2 diabetic that's medicated if you put your weight on. So it's really important that you keep seeing us for weight maintenance and we keep looking at your weight and keep monitoring your progress. It's important that you keep your GP informed with your progress as well and keep them in the loop. But what you will find is that if you do a type 2 diabetic program using Lipotrim, then what you'll find is that your blood sugar control subsequent to your weight loss should be even better than if you dieted normally anyway. And even if you've done a normal diet, and again we can still do that with our Waistaway Flex plan using partial replacements and weight check and advice, your blood sugar control afterwards may not be quite as good, and also you would still need to take your medication. So there's definite bonuses to doing total food replacement if you're a type 2 diabetic. I hope this explains what a type 2 diabetic can do to get their weight off and hopefully stop their medication. Thank you.